Good afternoon. Welcome back to Facebook Live and Oneida Live here on the Oneida Nation Reservation in Wisconsin. I'm Bobby Webster. I'm the PR director for Oneida. And today we've got a lot of information, so get comfortable, sit down and sit back. We have with us Michelle Tipple and Paige Dworak from the Oneida Community Health Center. And they've been working hard. There's been a study completed, got a lot of information, and they're going to share that with us today. So, why don't you start us off?
Oh, sure. Well, thanks for having us today, Bobby. Really appreciate the opportunity to come on Oneida Live and get the word out about a project that we've been working on, and it's called the Oneida Community Health Data Summary. So this is the first summary like this that we have published for the Oneida community. This project was meant to complement existing data collection and survey data already occurring within the organization and be another resource for the community to utilize. This project has been posted on the Oneida Nation website under the Comprehensive Health Division page. So before we get into the details of this project, I'm going to turn it over to Paige.
Hello, my name is Paige Dworak. I'm an epidemiologist with the Oneida Comprehensive Health Division, Community Health Services Department. I have been in this role since January of 2024, and my role involves collecting, analyzing, and interpreting data to ultimately improve health outcomes and help reduce the impact of infectious and non-communicable diseases, injury, environmental agents, and addressing the social determinants of health in the Oneida community, ultimately to promote health, prevent disease, and protect the health of all people in the community.
All right, so this project has got to involve a lot of collaborating with others and the research that you have to do, reaching out and making sure everybody's on the same page. So maybe you can tell us a little bit more about the topics and how you reach them and gain all this information.
Absolutely. So this project was a collaborative effort, and I do want to say a big thank you to all the departments and individuals who contributed data, provided feedback, and gave ideas to this project. Your insight was extremely valuable and appreciated. So a little background, the Ho-Chunk Nation Department of Health created a health profile like this a few years ago, which served as the starting place to create this for the Oneida community. And this project analyzes, interprets, and displays data from a variety of health topics and sources. Some of the topics include emergency room visits, socioeconomic factors, vaccinations, maternal child health, environmental health, and cause of death. The health topics in this initial version were selected based on available data, resources, and conciseness for the reader. We've already received excellent community feedback and are going to work to incorporate additional relevant topics in the next version. And this summary tries to use multiple data sources for a broad picture of health in the community. Throughout the summary, you will see both internal and external data sources. Some data sources will represent American Indian Alaska Native persons in Wisconsin, Brown and Outagamie County, and others represent Oneida Nation citizens. Some data sources will represent individuals who use the Oneida Community Health Center, which provides healthcare services for members of the Oneida Nation, their descendants, and surrounding tribes. I just ask that you please pay close attention to which data sources are being used on each page. This report is dated 2025 since that is the year that it was published, but data throughout the report does go back multiple years prior to 2025.
All right, so you mentioned that this was something that maybe the Ho-Chunk Nation previously engaged in and started off, and so I'm assuming there's a little bit of a test ground there. What kind of information is in there? And I mean, how does that information benefit the Oneida Nation?
Well, there's a few different ways that we hope this project and data could be used. The first is that the project could be used for community education and general awareness on health topics.
So, for example, as shown here with nitrate, there's various data sources that are presented depending on what you're looking for or what you are interested in. Nitrate can be found in well water and public water supplies, and exposure to high levels can lead to serious health issues. The maximum contaminant level is set to 10 parts per million. This level is established to protect public health, particularly vulnerable populations such as infants and pregnant women who are at higher risk for health issues related to elevated nitrate levels. So this page highlights the Oneida Nation Utilities annual water reports, which show that in 2024, all samples within public water supplies on the Oneida Nation Reservation were well below the nitrate MCL level. So it also shows Wisconsin Department of Natural Resources, or DNR, data in Wisconsin and in Brown and Outagamie County. From 2022 to 2024, 0% of public water supply samples in Brown and Outagamie County exceeded that nitrate maximum contaminant level. But on the other hand, you will see well water presented through UW Stevens Point data that shows 6% of private well water samples in Brown County exceeded that level and 2% in Outagamie. So this data just goes to highlight the need for homeowners with private wells to have their wells tested for nitrate every year. And this is just one example of how this data can be used for community education and general awareness on health topics.
Yeah, so in addition to community education and that general awareness, this data can be used as a starting place for program, service, and policy development or improvement. It could be used for funding or grant opportunities that arise as well.
All right. A lot of us have seen around the area billboards on STI, and we've noticed that they were kind of short-lived, but they were very impactful in the area. Can you kind of summarize how this educational campaign got started and how effective is it?
Yeah, absolutely. So the Community Health Services Department is using STI, or sexually transmitted infection data, from a variety of sources. So the data shown here represents American Indian, Alaska Native persons in Wisconsin, Brown County, and Outagamie County. STI data can help drive and inform primary prevention efforts. You may have seen these efforts taking place in the community, like Bobby mentioned, through STI prevention kits that were distributed locally, billboards that encourage and destigmatize STI testing, and other initiatives throughout the community that were supported by a prevention grant. In addition, we wanted to look at data from our own Oneida Community Health Center and with our public health jurisdiction. Data from multiple data sources tells us that STIs disproportionately affect young persons, meaning that young persons account for many of the new STI cases each year. So we're using this information to target and implement initiatives that help prevent, encourage testing, promote knowledge, and reduce STIs among young persons. We're also going to use this data to evaluate our initiatives and see if we're making an impact, a positive impact in the Oneida community. Additionally, we looked at vaccination data, and this page highlights the rate of receiving at least one flu vaccine during the 2023 to 2024 flu season. The rate among Native American persons in Wisconsin and Brown and Outagamie County was lower than the rate among all persons in those areas. So we wanted to get the word out that the CHS department has a flu prevention clinic taking place at the Oneida Nation Elementary School tomorrow, October 22nd, from 3:30 to 5:30 p.m. So come get your annual flu shot. And these clinics are open to tribal members and descendants who are registered with the Oneida Comprehensive Health Division.
So there is still need for further data collection and analysis. Finding health and wellness data specific for a tribal community has its challenges. Some of the reasons include how the data is collected, analyzed, and stored. Unfortunately, these conditions are not always within our control, but the Oneida Comprehensive Health Division is committed to finding and incorporating additional data that will help monitor the health and wellness in the Oneida community. Among the data we seek, also includes our own efforts in collecting Oneida-specific data throughout the entire organization. So, like all data sources, there are limitations and challenges, and this document highlights some of those throughout it.
All right, so what's next?
So this data is going to be updated every year, hopefully around the same time. With that being said, this is the first one for the Oneida community, so there's always areas for improvement and opportunity to add additional data sources, input, and ideas. So my email is located in the summary, and I would love to hear from community members and different departments throughout the organization.
I just want to take a second to recognize Paige for her work on this. And yes, it's definitely been a collaborative effort. This has spanned months, but it really took someone to drive and coordinate all of that. It's really been a blessing to have Paige and her expertise as we kind of grow in this, this search for data. So a couple other things that we've got going on. In addition to this project, we wanted to use this opportunity to advertise some upcoming events in the community coming out of the Oneida Comprehensive Health Division. So first we have our TRIAD Nutrition Class, and that's tomorrow, October 22nd, from 11 a.m. to 11:45 a.m. So there is a TRIAD Nutrition Class that will focus on healthy eating for the holidays, so that's always a good one. We have Protecting Our Air. There is an Oneida Nation Museum art exhibit. This was a really cool thing. If you guys haven't gotten out there, it highlights the work of Oneida youth that took place this summer. And it's just really inspiring to hear from our youth about the dangers of vaping and why we shouldn't do it. And then, of course, our November Memory Café, that's coming up November 12th from 1:30 to 3 at the Oneida Community Health Center. And so this month's activities is turkeys. So we hope that we'll see you at these events coming up.
The turkeys?
The turkeys.
All right.
I think they're paper turkeys.
So there was a lot of information, a lot of good information, and I'm trying to navigate through all these little technologies here. But did you mention how did you collect the data? Was it online? Was it hard copy? How did you target Oneidas to collect this data?
So there was multiple different ways. Like Michelle said, we really wanted to complement existing survey data that was already going on in the community. So we do the community health assessment, their quality of life survey. So this didn't include any survey data. This was internal and external data. So some was available on Wisconsin Department of Health Services website. Oneida Utilities, I was able to review their reports and incorporated that. Did some outreach to different departments. So enrollments department helped me out a great deal. So wanted to thank them as well. So there's a lot of different asking around, getting some feedback from other people, and then putting it all together in one place.
Now, I noticed you had a couple charts and graphs. I'm not sure if they indicated how many people that were interviewed that you received the data from?
If I personally did not interview anyone. I would say it was more collaborative. But if you go our title or our overview page, it's a list of the different folks within the organization and external that I did collaborate with. So, and I would like to thank them again for their
So then
help.
they use their target audience for outreach.
Yeah.
So if I work in this
Yeah.
area, these are the kind of people I work with, and I try to administer, and
Yeah.
then you had to collaborate and consolidate.
Consolidate, yeah, that's a
all
great
of the
word.
information.
Yeah.
Okay. Now you may not have the answer to this question either, but the Ho-Chunk have already done this. They sort of were the pilot project.
Mm-hmm.
Do we have any comparison, or do we know how successful it was with them? And can we compare ourselves and say we are as or close to how they did? Do we have any of their information?
No, we hadn't. That hadn't been a target of what we were trying to accomplish with it. It was really about getting some community-specific data out there. We used Ho-Chunk's example because they had put all that energy into it, and there really are significant challenges when you're trying to look at health, that broad perspective of health and wellness in a tribal community. So it was a really great starting point. We're really appreciative of those folks.
So you didn't want to reinvent the wheel,
Yeah,
but
right, yeah.
just a different vehicle.
Yeah.
All right. Well, this is amazing. And as you said, it's online on the page.
Yes.
Comprehensive Health. And gosh, I don't see any questions out there, but it looks like it took a long time to complete. And is there, I know I asked what's next, so we can look forward to more information coming?
Yeah, I would say this is going to be updated every year. And like I mentioned, my email is in the summary. And I would love to hear from different departments and community members if you have ideas of additional topics that could be in there or additional data sources to incorporate. I really want to expand it, and I've already received a lot of good feedback and ideas, and I just encourage everyone to send me the ideas. So
Sounds all
thank
good.
you.
Were there any challenges?
Finding the data is
Yeah.
one. We first, Paige has had an opportunity to interact with a lot of different areas. You know, that was part of her onboarding is let me introduce you to this division director in this area. So finding the existing data, But then I would say this year we spent a bit of time getting permissions to get access to some of that DHS data. So that was a process.
Process, yeah. Yeah, and I think just the time was a challenge too, just making sure that when you put something in there, explaining what it means, and like Michelle mentioned, a lot of limitations and challenges, and trying to represent those in the data as well. And but it was a great effort of many people that helped, and a lot of reviewers and people who gave feedback. So
And then
that helped.
I have one final question. Is this data for Oneida specific? Are we using it, or are we sharing this data with anybody else?
I know something that I do as a public health jurisdiction is I like to share our data with our Brown and Outagamie public health partners, because we work together on so many different projects. So that is something that will happen. But we've also shared the report with the CEO of Nation Services to share with his group as well, because the data in here is meant to drive improvements, programs, services, and so it doesn't have to be perfect. It has its limitations. It's clearly laid out in the report, but it's really intended so that people can be making data-driven decisions as they're looking at services, programs, and improvements.
So I did say that was my last question, but I have one more. So when you say CEO of Nation Service, that's our CEO,
Yes,
Oneida.
yes,
Okay. I know there's a lot of studies done on Indigenous people all over the country, all over the world, and sometimes we get a little anxiety over where that's all going. So I think it's very important, it's very helpful to know this is our study for our purposes, and certainly our purposes are off the counties. I know, Michelle, you and I worked with Brown Outagamie County and the health department through COVID, through thick and thin, and it was such a benefit to all those involved to partner and to collaborate on and share that information. All right, is there anything we forgot to mention?
No, just thank you so much for your time, Bobby. We really appreciate the opportunity.
It was great to have you here. And that's all we have. On Thursday, we have with us Councilwoman Jenny Webster. So tune in and see you on Thursday. Yawʌko.
Thank you.